Hello, everyone. Welcome to our first ever webinar by Plabish. Thank you for taking out time from your weekend for us. I hope you're all having a great weekend today. My name is Dr. Khubab Samdani, and I am graduate of Rawalpindi Medical University. And I hope we have Ravalians in our webinar today as well. I am co-founder of Plabish. I took my PLAB1 in November, and my PLAB2 is scheduled to be in June. I would like to talk about Plabish first. If you have seen our post in the past and joined our community, you might have a little idea that Plabish is about PLAB1. It's first ever Pakistan's community from Pakistan, which is going to provide you a platform which have all the different aspects of PLAB1 preparation, not just the QBank and flash notes. While I was preparing for PLAB1, I felt that there was a lack of a community which offers coaching courses and webinars related to PLAB1. And this was in our mind when we were aiming to make Plabish. We have QBank, flash notes, and memory hook. Besides that, we are going to uh, provide you with crash courses as well. So people have requested us that they have their PLAB1 while they are in their house job, and they wanted us to uh, provide them a comprehensive guideline on how to prepare for PLAB1 while they are preparing, while they are in their house job. So I would like all of you to please go on Instagram and follow us, where we post all kind of updates. We are posting daily MCQs, which are high yield based on recalls from previous PLAB1 exam. And we make interesting memory hooks, mnemonics. So kindly follow us so you don't miss anything from us. And we also have our WhatsApp community, which have many subgroups, uh, like finding study partners, discussing MCQs, and different dates of PLAB1 exam if you have in the respective months. So you can join there as well and meet your fellow students. So coming to PLAB1, PLAB1 is an MCQ exam. So how many of you are from final year in our webinar? So those who haven't booked PLAB1 already, PLAB1 is an MCQ based exam which have 180 MCQs, and you have to attempt those MCQs in 3 hours. And the content of PLAB1 exam is that they ask you the knowledge that you are required to know on the first day of your FY2. And if you want to book PLAB1, you need to have MBBS degree. So you cannot book PLAB1 before getting your degree or before passing your final year. So you can only book it after you have passed your final year. And you are required to make GMC account and provide evidence of English competency, which you can provide by either OET or IELTS, which is another debate which one to choose. And PLAB1 dates are released twice a year in June and November, and it's conducted 4 times a year. The fee of PLAB1 is about £255, and its venues are managed overseas by British Council. The passing score varies between 110 to 118, and the pass rate is roughly about 70%. And PLAB1 is valid for 3 years after you pass it. So this is a PLAB1 blueprint, which you can have a look at from GMC UK website to know what are the topics, what are the domains and systems that are tested in your PLAB1. So basically, PLAB1 curriculum is took from UK Foundation program curriculum, which you can read from the Foundation program website if you're interested. And if you have more questions about PLAB1, you can visit GMC website where all your queries uh, might be answered. So now I would like to welcome Dr. Saad Azhar to the webinar. Saad, are you there?
Yes, Hubeb, thank you.
Thank you for joining and taking out your precious time. Saad Azhar is my friend from college, and we shared an hostel room for 7 years, and we were classmates. We are from batch 44, Rawalpindi Medical University, and he passed his PLAB1 in May 2023 while he was in rotating in his general surgery rotation, which is one of the hectic and demanding rotation of household. And he took his PLAB2 in December, and now he's GMC registered and currently in United Kingdom looking for jobs. I hope, Saad, you are having a good weekend.
Yeah, Hubeb, I'm having a great weekend. Thank you so much for the wonderful introduction. Yeah, hello everyone. Hubeb introduced me pretty well. My name is Dr. Saad Azhar. I'm a recent graduate of Rawalpindi Medical University. I cleared my PLAB1 in May of 2023, and I recently cleared my PLAB2 in December. Now I got GMC registered and I'm looking for jobs. So, first of all, thank you so much to all of you. I hope you're having a great Sunday. Thank you so much for taking out the time to join our webinar. And we really hope that it is worth your time and we answer all your queries. Um, so, Khubab
So
did
how is
a
the
very,
Saad? How is the temperature today in UK? You must have heard that in Lahore, it has become like Antarctica, and that's why I'm wearing this heavy jacket right now. So how is it like today in
yeah,
your
it's
place?
always cold in the UK, and the problem is not the temperature. It's raining. There's no sun. It's always cloudy, so that's
Hmm.
what makes the winters even worse. But yeah, I'm getting used to it now.
Okay.
Moving on, Huwab did a very good, brief and concise introduction of what the PLAB1 exam is. And yeah, here are some pictures of us doing our house job during the winter months. I guess it was about this time, December, January.
Do you
Um,
miss household, Saad?
no, I don't. No, not at all. But
Uh,
yeah, to the people, to all the juniors who are nowadays doing the house job, I understand it's a tough time. It's a very tough time, but make the most of it. Try to make some memories, and if you are giving any exams, best of luck. You can do it. You can go through it. Okay.
yes, most
So
of people have joined who have exam in Feb and May who have booked their exam,
mhm.
especially house officers. And but we have final year medical students as well who are interested in pursuing PLAB pathway. So we'll have to cater to the needs of both of these categories. So how did you survive tough house job?
um, I don't think I survived. I think I died a few times during house job. But yeah, a good support system from your friends and good seniors, taking time out for yourself, for your hobbies, going outdoors. It helps. It's a tough time, but yeah, you have to take time out for yourself. You have to prioritize your own mental health. Um,
Hmm.
yeah.
Okay. So first thing first, Saad. Uh, People say that PLAB1 is just an easy exam. Whenever you ask your senior, okay, how to crack PLAB1, and they like PLAB1 is like halwa. So, do you really
Mhm.
think that PLAB1 is an easy exam?
Um, so actually, yeah, I do think that the PLAB1 is an easy exam. And I'm not saying this so you guys let your guard down and you stop studying. And those of you who have their exams close by, they become overconfident. But compared to many of the foreign exams that people usually have to give, like the STEPS exams, or the Royal College exams, or some other exams some other countries, I think the PLAB 1 is a relatively easy exam. um, and
Mm,
Yeah, so I think it is pretty
mm,
easy, and it is possible. It's a bit
mm,
tough because most of the people nowadays have booked their PLAB 1 during their house job, or for the people who are from outside Pakistan during their internship. So that is a tough experience, but it is doable.
mm.
So yeah, I would
Yes.
say it is a fairly easy exam as long as you put
Mm.
your effort in, as long as you do the hours. So yeah.
Yeah, Plab one can really challenge your management skills. So if you're in house job, don't take it like lightly. Just learn the management of important daily cases that you are seeing in your house job. So if Plab one is that easy, so why do people fail Plab one? If we look at the stats on GMC website, in
Mhm.
2022, 14,000 people attempted Plab one, and out of that, roughly 10,000 people passed. So why do those 4,000 people fail the PLAB one if it's fairly easy?
Yeah, so that is a very good question. I think the passing stats is 70%, right?
Yes.
So, unfortunately, this is an opinion for now. I can't, comment on this with certainty.
Mm,
Um, but I think the reason the 30% people fail this exam is because either they do not know how to manage their time, which is the main hurdle in passing this exam: time management.
mhm,
They may make any sort of blunders during the exam. They may not mark the OMR sheet correctly, and which is rare, but it happens, and uh, and even though it's an easy exam, you still need to study for it. You need to give the 1, 2, 3 months of study, of preparation to it, and obviously you can't expect to pass without studying. So a lot of people do not have their first priority as PLAB 1. I've heard that people in some other countries, they may book the exam because it's easy, the seats are easily available, but people might not study
mm.
as well,
Yes.
you know and that is why the passing rate falls a bit. But
Mm,
that does not mean that it's a difficult exam. If you put in the work, if you put in the effort, I think it's pretty possible.
mm.
um, so
Yes,
yeah.
sir. Saad, when I was in PLAB, giving my PLAB one, and when I was looking at the question, I thought, yeah, it's really easy. But
Mhm,
the dilemma is that those questions can be twisted. Like when you look at the question, you straight away get the diagnosis, the management, but they have twisted the question
mhm,
to test the concept. They're actually
mhm,
trying to check the concept because they know that now, back in 2017, the Plabable was not there. Plabable came
mhm,
in 2017. Before that, there were only 1,700 MCQs of Dr. Khalid and Samson course, and people that at that time Plab one used to be easy, but now. Because more people are attempting it and more people are doing Plabable, like they are doing Plabable twice or thrice, Medrovian, Plab one keys. So now they have made Plab one a little bit difficult with time. With Saad, we are going to discuss a couple of things today. First, we will talk about resources and study material. Then, we will move forward to the strategies for solving Plabbable QBank, and then high yield topics, and then the plans specific to house officers and how should they manage time for how for the Plabban study uh, while uh, while their house up is going on. And then we will also come to mocks and big mocks, exam day tips, and Q&A session.
yeah, so I think that is a very good selection of topics to discuss, and pretty much will cover it all. um, Starting with resources and study material for PLAB 1. And this is probably the most confusing question or query someone who was planning to give PLAB 1 or who has booked a seat might have. Um, and first and foremost, I just want to say don't waste time on picking a resource. Okay, there's no magic resource that you will take and you will pass the PLAB one. Um, because people are confused. Should I do Plabable? Should I do med revision? Someone says that the Plabable people fail or the med revision people fail. It doesn't matter. What matters is that you stick to one resource and you are consistent. Okay, so let's dig a bit deeper into it. We have two question banks, mainly the Plabable and MedRevision. Hopefully, in the future, we will have Plabish as well, but I think it's still in the works. So for now, we will just discuss Plabable and MedRevision. I personally did Plabable, and I think it was very sufficient. I found it really good. I loved the questions. I loved the interface, and I've done some sample questions of med revision. We will discuss the differences in a few slides, but broadly speaking, Plabable has like 3,400 questions. Med revision has, I guess, 4,500, 4,600, and their explanations are a bit long. But at the end of the day, it just matters what you are more comfortable with. Whatever resource you are comfortable with, you can choose it. Both are very good for passing PLAB one, and yeah. So what?
Hmm.
So then people ask what notes you should study or what material you should study to attempt the questions, and that's a very good question as well. Because I remember asking my seniors when I first booked the exam, should I? In Pakistan, we have these books called Davidson and Step Up for Medicine. So I used to ask my seniors, should I, go through those books once again uh, for attempting PLAB one, or should I study the surgery book or the peds book or the gynae book once again for this exam? And uh, by the way, I just did Plabable Gems and I did the Plabable Question Bank. But in the start, I was very confused and I was not confident at all with my approach. So, one thing that you guys should know that everyone who attempts this exam is a graduate, is a doctor. So they have already passed their final year exams. They've already studied medicine and surgery and gynae and pediatrics. So they don't really need to, go through all of it once again. Okay, they have already studied it. They just need to review it. And Lab One is a very superficial exam. Okay, it just tests your superficial knowledge and it tests your knowledge of the UK guidelines, basically. And we will get into that in a few minutes. So yeah, first question that some people might have: if you are a fresh graduate,
Hmm.
or even if you have graduated in like the last 1 year, 2 years, or if you are a student, you don't really
Hmm.
need to, go through your textbooks, and a lot of it depends on your baseline clinical knowledge. If you attempted your final
Hmm.
exams really well, I think you will find PLAB 1 really
Hmm.
easy. If you have weak basics, weak concepts, like me, my basics were not too good, to be honest, because I just gave
Hmm.
my exams through keybooks and past questions. So my final year knowledge was a bit
Hmm.
weak, so I had to study a bit more to strengthen my concepts. So yeah, for Plab one,
Hmm.
you can either use the gems, you can use Plabable keys, you can use med revision notes, and there are a few other resources that I can discuss. But you don't have to go through your textbooks once again. Okay, it is entirely doable with
Hmm.
just these resources.
Hmm.
So
Yes, exactly. Those who are in final year right now and they're planning to give Plab one during their house job. I think you just need to focus on your books because I read first aid during my final year and step up really good. So I had good baseline knowledge. So this is how you can prepare for Plab one in advance. So Saad, you talked about patient.info and nice guidelines to complement our study for PLAB 1.
yeah, Khobeb. So when I was preparing for my PLAB 2, I came across this website called patient.info, and I really wish I had come across this earlier. So patient.info, it has a lot of these articles and articles on many different topics. many of the common topics that we come across. And the good thing about this website is that not only will it help you to revise, it can be used as an alternative to a textbook. For example, you feel you are weak in some topic, okay? You need to study like hypertension, or you need to study appendicitis, and you don't want to open your textbook and read through 2 or 3 pages of text. um, what you could do is you could open this website. It has everything written from the symptoms, management, investigation, treatment, and the best part is it is all written according to and compliant to the NICE and NHS guidelines. So when you study from here, not only will you revise your topic, you will freshen your knowledge, and
Mm,
you will also be up to date with all the guidelines and the algorithms
mm,
of that particular topic. So yeah,
mm,
if you do feel like studying something extensively
mm,
other than the PLAB gems, other than the PLAB keys, you can use patient.info. And the most
mm,
authentic resource of all, you can go to the NHS website, you can go to the NICE website. Obviously, everything there is accurate, and it is the most authentic source of information. It might be a bit difficult to read for some people, the articles, but Khubaib will explain how you have to study from the NICE website. If yeah, you can go ahead, Khubaib.
Yes, for nice guidelines, if you're having a difficulty in understanding a topic and you feel uh, that it's really complicated, then go to the NICE. You will have to use the VPN to access NICE because they are only accessible in UK. And do not download this guideline because it's too extensive and you won't be able to read it in 1 year. So just download these visual summaries, and these are very useful, just like patient.info. Saad told me about patient info while he was preparing for PLAB 2. I still use it. Working as a medical officer, and if I see a new case and I don't remember its detail of management, I just go to Google, type the detail, and just type patient.info, and I read the article on it. You have to read the professional article, which is written for healthcare professionals. So just like that, you can also use NICE guidelines. This is an example of a NICE guideline which I prepared my hypertension topic for. It is amazing. This has helped me, and this is helping me still now while I treat my patients in my clinic. I'm seeing about like 30 to 40 patients per day, and I am trying to incorporate these guidelines in my own practice. So I am well prepared for PLAB 2 as well. Of course, I have to go to the UK and I work as a doctor. So try to get the grasp of good resources from today. So download these nice guidelines. This is a very good picture which I use, and we have included it in our notes as well. And we use them to teach our students. So people who want to enroll for Plabish coaching, they can enroll because we have taken all of these amazing flow charts and diagrams in our notes which we use to teach. So now, Saad, can you please tell us about the strategies which you used for solving Plavable Q bank?
Yeah, Khubaib. So I will get to that in a moment. I just wanna go back and emphasize on something. Full disclosure, I did not use the NICE websites or the CKS websites that frequently when I was preparing for PLAB 1. The reason we are suggesting these tips to you guys is because, you know, first of all, when you eventually come to the UK, when you give the PLAB 2 and you start looking for jobs and you practice here, you will realize that the NHS is, uh, NHS really takes its pride in its protocols and guidelines, and because they are tried and tested and researched. So this will help you not only in PLAB 1 or PLAB 2, it will help you in your future too. So yeah, take your time, put some effort, always read these guidelines, read these protocols, these algorithms, and they will really help you, as I will, explain in the next section. um, Learning these guidelines and algorithms will really help you, uh, at least some of them, for example, the important ones like hypertension or asthma. They will help you to solve the question easily, okay, and they will help you in your future career as well. Okay, they will help you in your career in Pakistan when you're treating patients, because the NHS guidelines, the NICE guidelines, they're universally accepted guidelines, and they are well appreciated by people from all walks of the healthcare community. So yeah, moving on, strategies for solving the question bank. So even though we've written that these are strategies for solving the plabible question bank, uh, these can apply to any other question bank you are using. For example, if you plan to use the med revision question bank, you can still use these strategies. These are just general, advices, tips, and tricks. So yeah, don't worry about it. You can use it for any question bank. Start with your sweet spot. So what I mean by this is, uh, if you are starting your question bank, some people might already know. If you don't know, you have these modules of questions that are divided based on topic. So you have cardiology, dermatology, then you have all the surgery allied topics, then you have pediatrics, gynae, and so on. So start with those topics that you are good with, that are your strong suit. So uh, because
Hmm.
of that, you will gain the confidence and momentum, because in the start it takes some time. So it will really help to begin with something that is easy for you, that is digestible. So for example,
Hmm.
when I started my preparation, I had already done my cardiology rotation, I had done my medicine rotation. So I started with cardiology, I started with general medicine, I started with some topics like gastroenterology, and I found them really easy because I had learned the topics in my rotations. I knew how to read an ECG, I knew how to manage all the basic conditions that we come across as an intern in the medicine wards and ER. So
Hmm.
yes, I did those topics, in a few days, and so yeah, that
Hmm.
really helps starting with your, topics that you're good at.
Hmm.
Okay. Anything you want to add, Kuber?
Yes, I would like to add that you should capitalize on your rotation. So, if you are currently rotating in orthopedics, try to finish the orthopedic Q bank first, and try to use the NICE guidelines and patient.info. And also, Saad, we have questions coming in. I'm going to take some questions, and you can send in your question in the chat or in our WhatsApp group, and we will try to answer every question. But the question which is relevant with this discussion, Zoha has asked, for medicine, is it suitable to study from Oxford Handbook of Medicine?
Yeah, yeah, that actually is a very good resource. Sometimes it can be a bit extensive, and usually when people are studying for their PLAB 2 and when they're preparing their whole cases as part of the OSCE,
Hmm.
I've seen people using the handbook then more frequently,
Hmm.
but you can use it for PLAB 1 as well. Yeah, you can use it
Hmm.
to for the guidelines, for the algorithms, for the flow charts.
Hmm.
Um, yeah, that is a good
Okay.
resource. It's more helpful during PLAB 2, but I think you can use it during PLAB 1 as well.
Hmm.
Uh, but because the PLAB 1
Yes.
is a bit of a superficial exam, sometimes too many textbooks can be a bit of an overkill. But I guess you can use it. Yeah, if you have the time, you should definitely use the
Hmm.
official resources that are endorsed by the NHS, by the GMC.
Hmm.
So yeah,
Yes. Especially if you're final year or in your house job, just complement your clinical practice, complement your studies with even if you're rotating in your wards, it's a good source to carry with you. So moving forward for the Q
actually, the
bank.
Oxford Handbook for Emergency Medicine, I think it really helps in the house job, and it's yeah, if you're a medical
Hmm.
student, if you're starting your house job, maybe you should have that book with you.
Hmm. So moving forward, Saad, what are
Yeah.
the
So
more
unleash the
advices?
comment section. So those of you who have already used a Plabible question bank, if you use it on the PC or the laptop, I think we also see it on the mobile phones, but I'm not sure. So you can have this comment section on the right side of the window, and uh, So why we mentioned the comment section is that sometimes when you attempt a question and it's wrong, and you go through the explanation and you're not satisfied, okay, you're not particularly satisfied. Sometimes people have written very good explanations in the comments, that are easy to understand in easy words. uh, Sometimes the creators of the Plabible question bank, they might themselves give some answers or explanations on the tricky questions. So that is a good tip that I actually did use during my preparation. Some of the comments are really helpful. They have mnemonics, they have useful flow charts, and you can just write some comment on that uh, comment box, and afterwards when you need to go back to that particular comment, I think there is a feature in the Plabible app that you can see all the comments you've written on different questions. So you can directly go to those questions or comment sections if you have just written a comment there, okay. And so they really help sometimes. um, Seek clarification, not just solutions. So when you are stuck, okay, or when you give a wrong answer and you need to read the explanation, please spend your sweet time on reading the explanations, okay. The extra 5 minutes or 10 minutes that you spend on reading that particular guideline, or on memorizing that uh, algorithm or guideline, um, it will make a lot of difference in the long run. um, so
Hmm.
it will save a lot of time in the long run,
Hmm.
because if you do not solidify that concept in your mind, you're just gonna make that question wrong, get that question wrong 10 more times, and obviously you haven't saved any time. So some people, they just wanna do all the questions, achieve their daily target, tick that box on the
Hmm.
checklist. um, Please spend your time, when you do a question wrong, you need
Hmm.
to figure out what was wrong in your thought process, where you went wrong. And
Hmm.
unless you completely understand why you chose that answer, there's no point going forward, okay. I always tell this to
Hmm.
my friends and my juniors. It's better to have done 60 or 70% of the questions from a particular topic, but you know the concept well, than doing 100% of the questions, but your concepts are flaky, your
Hmm.
concepts are weak. So this might sound very cliche.
Hmm.
My seniors used to say this to me, and
Hmm.
I say this to everyone. I say this to my juniors. Uh,
Hmm.
Please focus on your concepts. Plab 1 is mainly about two things. It's about having good concepts, and it's about having good time management skills. Okay, so moving on, tame the giants first. Okay, sorry, excuse me. So what that means is, for those who don't know, in the Plabible question bank, there are certain topics that have like 200 questions or 250 questions, 180 questions. And when you start doing those question banks, sometimes it gets so prolonged that you might not be able to finish it. You get bored, and
Hmm.
you get discouraged because you're getting questions wrong and you've spent already 10 days on that particular topic. So you might leave it altogether. So for that, our tip is that you should, divide those topics into chunks. For example, if you have 200 questions of pediatrics, you can do 100 questions today. You can do 100 questions a day later, or you can do 100 questions 2 days later. Okay, it's not that
Hmm.
you forget your pediatric knowledge in 2 days. So
Hmm.
uh, there's no,
That is a very
yes, ma'am.
beneficial advice because when I was doing Lab 1 preparation, I was feeling stuck on neuro and psychiatry because they have like 250 and more questions. So what I did was I did about 125 questions, and was not able to finish the whole question bank of that topic, but I did half of it, and but doing half of it was enough to gather the grasp of all the commonly tested topics, because I was mastering the art of wrong. I was mastering those questions which I was getting wrong. So whenever I get tested on that topic, for example, if it is rash, it can be really confusing to pick a rash from measles, scarlet fever, they can make it very complicated. So but you have to correct your concept right there and then. Go to the Google, look at the pictures, read the gems, whatever resource that you want to use, but get it done, dusted there in like maybe spend 30 minutes, but get the complete grasp over it. So never again you have to worry about rash again. So doing spending 30 minutes on one question can help you crack next 20 questions instead of jumping around rushing in completing the q bank. So if you have less time and you are worrying about whether I should focus on completing the q bank, then don't need to worry about it. I didn't complete the whole q bank. I told you, for neuro psych and for peds I was not able to do all the questions. I did about half of them, but it was still enough.
Exactly, Khubab. That is very beautifully explained. Guys, if you get something wrong, leave everything and get find out the reason why you went wrong. And for example,
Mm,
you know, and I think I personally make this mistake. I made this mistake a lot during my preparation, and I did get a few MCQs wrong because of it. So, for example, there's a question about asthma guidelines. Okay, in the PLAB one, mostly questions. When you start your preparation, you'll see that mostly questions are about what is the next best step, what is the initial step, what is the golden investigation. Questions like these that are derived from many algorithms. So, if you chose an incorrect answer on one of these questions, leave everything, open up the guideline on another window, and just memorize the guideline, and until you are it's on your fingertips, until you can draw it on the paper, you can write it by memory. So because that will really help. I
mm,
don't recommend memorization and rote learning normally, but for the algorithms, for the guidelines, you do need to memorize them. You do need to spend a bit of time doing ratta, as the
mm,
Pakistanis call it. So yeah, those were some of the strategies for solving the question bank. And something I forgot, uh, when you are attempting the question bank, there's an option to flag the questions that you did wrong, and you should definitely use that option whenever you do whenever you choose a wrong answer, or you find a question that is tricky. You should flag those questions so you can come back to them later, and instead of going through all the question bank once again, you just need to revise the flagged question. You just need to revise the tricky questions, and I think that's enough for your revision. You don't need to go through everything
mm,
once again. So yeah, you
mm.
do choose that option. Okay.
बिल्कुल। जो सवाल आपका एक दफा ठीक होगा वो हमेशा ठीक होगा। दिस इज व्हाट आई बिलीव इन। Once you get a question wrong, you are prone to get it wrong again.
Mm-hmm.
So no point
Exactly.
is no point in going through the corrects. I never used to even read the explanation of correct question. If I get a question correct, then I move forward because I know whenever I get the same question, I'm gonna always get it correct. But the question which I got wrong, I used to read the explanation of that. So Saad, now we will be talking about Plabible versus Medrovian saga, because if you open any platform on your phone, for example your Facebook group, you will see that question, okay, whether I should use Plabible, whether I should use Medrovian. So I have gathered the screenshots of their comparison. The
Mhm.
Plabible has 3400 questions and they have like 20 mocks, while Medrovian have 4600 questions and they have 26 plus mocks. So regarding that, what would you say, Saad?
So like I mentioned, I actually did the Plabible question bank, and I did not do the med revision one. I did some sample questions. So as far as I know, I think both of those question banks work. Most of my colleagues and friends did the Plabible one, but I have heard of few people who did the med revision question bank, and they passed, with good scores as well. So there are a few differences. I think I did the questions from both of them. The questions are of the same style, the same standard as tested by the PLAB1, tested by the GMC. Plabible has fewer questions. It has smaller explanations. The subscriptions are for shorter periods. In contrast,
Hmm.
In comparison, the med revision has more questions, it has longer explanations, it has more mocks, and you can get longer plans for it. So, for example, you are a medical student and you want to give PLAB1 during your house job, you can choose the med revision 12-month plan or the 24 months plan. So you can study in your free time. You can attempt questions, and that way you are preparing for the PLAB1 along with your studies, and it will really help you in the long run. It will make your preparation really easier.
Mm.
So yeah, if you can afford it, I would say you should go for the med revision plan.
Yes.
And in case you feel like you don't like it, you can always choose the Plabable in the end for the 3 months period or the 5 months period. Um, so yeah, but
Mm.
as far as the exam success goes, I think you can easily pass the exam with any of the question banks. It
Mm.
does not matter whichever one you choose. It all
Mm.
boils down to whatever you are comfortable with.
Mm. Yes, for Plabish, we are also aiming to make our own Q bank as well. And one of the feature that we are aiming to make for you is that once you buy the subscription, you can have it forever, and you can even gift it to your juniors. Because I believe that if there is a medical student and he is in second year and he want to go for PLAB, he should be able to buy a resource and have it till the last day of his medical school, not just when he's about to give the exam. So this will be our primary focus, that we make a resource, we make a QBank that you can access uh, forever, and you can even gift it to your juniors. So Medrivian, I like its feature that they have customizable mocks, and you can choose topics that you like, and then you can only uh, uh, give mock of those topics. Hmm. So now we will be talking about high yield topic. If you're in house job and you are planning to divide the topics, and how should you divide it? So Saad, in your opinion, you told me about these TVN. So please guide those house officers.
Yeah. So as a rule of thumb, those topics which have a lot of questions in them, obviously they are the big topics. They are topics that have repeatedly been tested. So yeah, that means they are important topics. Um, Most importantly, we have cardiology, endo, respiratory medicine, GIT, peds, obs and gynae, neuro and psychiatry. I think emergency medicine should also be in this category. And then we have topics that are a bit small, but are really important. Okay. Um, and I need to mention this before I go ahead, that the GMC has no set criteria for how many questions they'll take from any particular topic. Okay, it's all mixed up, and there's no set number. So uh, our experience on what topics are important is based on whichever topics keep repeating the most in people's exams. So according to that, yeah, cardiology and all these other topics I mentioned, they are the most important. In the smaller topics, ethics, epidemiology, derma, uh, rheumatology, urology, uh, they are very important. They always have questions in the exam, and especially ethics, epidemiology. These are topics that are really small, and sometimes people may skip them, because they may feel that they know the topics well, or they may have a few questions in the real exam. But the thing is, epidemiology questions, once you know the formulas, once you know how to attempt them, those are free marks, okay? Those are easily
Hmm.
attemptable questions. So always do
Yes.
epidemiology, always do ethics, because the GMC really focuses on ethics. There will always be questions of an ethical nature.
Hmm.
There will always be questions from psychiatry, and this is something I learned the
Hmm.
hard way because I did not do psychiatry for my exam. I did just 20 or 30 questions from Plabible, and in the real exam, I had a lot of psychiatry questions, and unfortunately, I
Hmm.
did attempt a lot of them incorrectly. So yeah, you
Hmm.
should focus on these topics. That does
Yes.
not mean that we should, leave the other topics entirely. But in case you are very short on time, or you need to figure out what to revise for the end of the exam, for the last 2 or 3 days of the
Hmm.
exam, These are the topics you should focus on.
In my exam as well, I felt like there was not a good distribution of the content of exam. Like I had a same question in November, like same question was asked thrice. Like it was a of course a lack of good shuffling because they use software to shuffle the questions. So sometimes a similar type of questions from the same topic can also appear. So for example, if you say let's skip epidemiology, it's a small topic, maybe one or two questions from epidemiology will come. But if you get lucky, you might not get even a single question, but sometimes you get like 4 to 5 questions from epidemiology. So I
Exactly.
would never recommend you to leave a entire topic. You can touch the topic, but just make sure that you go through every topic, even if you don't spend enough time. Because you never know that you can get a question on electrolyte imbalance, like 3 questions testing you on the knowledge of hyperkalemia, hypokalemia, and they can be in different domains. For example, one question will be from emergency department, testing you on the management of hyperkalemia. One question will be from nephrology, and one question will be from pharmacology. But all of these domain will be from hyperkalemia. So this is why you cannot skip electrolyte imbalance like hypokalemia, hyperkalemia. Even they have an overlap in endocrinology as well. So it is highly advisable to go through every topic.
Yeah,
So
exactly,
now,
Khubair. Yeah, so that is very
hmm,
good advice. And We do not recommend skipping any topic, but in case you are short of time, at least go through the gems so that you have some concept of what what kind of questions you might get in the exam. So do the bigger topics first, and if you have some small topics left towards the end of the exam, just go through their gems, just go through their plab keys. Okay, so at least you know
hmm,
something. And in the last slide,
yes.
emergency medicine was written a bit down. I personally think that it's a very important topic uh, because the ABCD protocol and attempting it and interpreting it in the case of questions, it's a bit tricky. People get a lot of those questions wrong. So yeah, get comfortable with emergency medicine, use the guidelines, learn the algorithms. Like someone mentioned, you can use the Oxford handbook for studying. You can use patient note info. So yeah, it's a very important topic as well. And
Hmm. Now, moving forward to the plan specific to Houseop, as we're a bit short on time, so we will try to uh, cover the plan that you need to pass your PLAB1 while you are doing your Houseop.
Okay. I'm gonna be honest, guys. I'm not gonna lie. It is tough to give the plab one during house job. It is because house job is already very physically and mentally exhaustive. It is a very stressful exam. It is a stressful experience. I booked my exam in the first month of my house job, and I had my exam in like the last month of my house job. So 12 months, I was constantly under stress. Even when I was not studying, I was just thinking about my exam. And looking back, I had the opportunity to book my exam in Feb of that year. I could book it in November of the previous year, 2022. But because I was not confident if I could study in my house job, if I had enough time, so I took the date that was available to me. That was the furthest available date, and in May of 2023, that was the last month of my house job. So what I want to suggest to all you people who are either starting the house job or who are medical students right now, if you are getting an earlier date, go for it. Okay, I know it's a big risk. It's a leap of faith, but you should go for it. It's entirely doable, and I will explain how. But if you have 3, 4 months, 5 months uh, till your exam, you can still do it. It might be a bit tough, but it's still better than waiting the whole year for an exam. um, because at the end of the day, I also started studying 4 or 5 months before my exam, even though I had booked it like 11 months. I had 11 months to prepare for it. So yeah, Try to choose a rotation, and these advices are not just for the house officers. If anyone here is a medical officer or is doing any non-clinical job, who is a trainee, a PG trainee even, uh, just choose book the test in a rotation that might be considered relaxed. In our hospitals we had derma, psychiatry, anesthesia. These were considered chill rotations, and whatever works in your hospital, choose a chill rotation and plan your plan accordingly. um, you will need to take leaves. You will need to take leaves of 2 or 3 weeks maybe for your exam to prepare. If your exam is in a rotation that is hectic like mine, I had my exam in my pediatric surgery rotation, and before that I had a general surgery rotation. So these were both very hectic, and I honestly was not able to study much during the rotation. So I had to take a leave,
Hmm.
15, 20 days leave at the end to revise and study. So
Hmm.
prepare accordingly. Talk with your, if you're a house officer, uh, if especially if you're doing house job in the Rawalpindi RMU hospitals. Talk to your department, talk to your HOD, your consultants, your colleagues. Make arrangements for a leave, and you can always do an extension. What an extension is, for people who don't know, you can do your extra days after the end of your house job, after the end of your internship, because the exam is the priority. It matters that it doesn't matter if you spend 10 or 15 days or even 20 days after your internship, uh, because of your leave. But it does matter that you give the exam and you clear it, and obviously that is the first priority. So yeah, make arrangements for leaves, but at the same time, uh, do not take any gaps in your internship. Your internship should be continuous 12 months. There should not be gaps between. So yeah, if you do take leaves, make sure that the experience certificates that you do get from your hospital,
Hmm.
they're continuous. Okay, there's no gap in there.
Hmm.
So yeah, that is something that you will have to plan accordingly with your respective departments,
Hmm.
with your HODs, and that is all about leaves.
Yes.
So what if?
Hmm.
Yes, Khubair.
Yes, Saad, what helped me during house job for preparing for Plab1 was I took interest in my ward rounds, morning meetings, and consultant teachings as well. For example, in emergency department, when we were using different drugs for emergency conditions, I used to read about it because it helped me in my exam. So during your house job, try to take extra interest in common managements like. Should we give normal saline or should we give lactated ringer, like which conditions need normal saline, which condition needs a lactated ringer. So try to read about it and ask your PGTs or your consultant about it, because it will be really beneficial for you regarding PLAB1.
Exactly, guys. That is actually very good advice. When you are an intern, when you're a house officer, you will come across a lot of diseases. You will manage a lot of patients. Okay, so this is a good thing in Pakistan, that you have the chance to get a lot of experience, see a lot of patients. So the thing is, you're already in a clinical setting. You're already treating patients. So why not um, read up on that disease, read up about that disease according to the NHS
Mm,
guidelines, according to the NICE guidelines, and manage accordingly. Okay, because you already are managing patient. For
mm,
example, you are a house officer in the medicine ER, and you come across a patient of diabetic ketoacidosis. So if you know the NHS guidelines, you can just manage the patient on your own and according to the guidelines, which are not that much different from our local guidelines. Okay, they're just a procedure. There's just some steps to follow. And when you're writing your notes in during ward duties, you can write the plans according to the NHS guidelines that you know. Okay, and it doesn't mean that it has to be followed A to Z. you just have to write it, okay, and you can follow it as much as your hospital allows. Since some
Hmm.
medicines might not be available, some equipment may not be available, some lab tests. So uh, try to incorporate your learning into your
Hmm.
real life scenarios, real life,
Yeah.
clinical scenarios. Okay, involve yourself in meetings, in the ward rounds, and
Hmm.
you know when you are studying when you're studying the question banks, when you are in during your duty, you can always bring a hard copy of the Plabible gems or the Plab keys. Like I had a printed copy of Plabible gems, and I used to bring it everywhere with
Hmm.
me to the hospital. I On calls when I was free, I would just open up my book and start reading the Plabible gems. And
Hmm.
some people like to do questions. I found it a bit distracting in the hospital environment, so I used to just read the Plabible gems. And you can do a lot of productive work, if you just try to keep yourself busy. Okay, I know it's tough, it's easier said than done, but uh,
Hmm.
if you have to pass Plab 1 during your house job, you have to uh, go through it. Okay, this is something that you have
Hmm.
to take grind. So yeah,
Exactly.
you can, some
हाँ
people,
और
the question banks are available on the mobiles, on your tablets, so you can just bring them with you on your duties and study.
ऑलराइट यस बिल्कुल और मैं बच्चों को बताता चलूँ जो फाइनल ईयर में है या हाउस जॉब कर रहे हैं तो आप आराम सुकून से 30 दिन की या 20 दिन की छुट्टी ले सकते हैं नियर योर एग्जाम एंड देन यू कैन fulfill that gap afterwards so you can talk with your head of department regarding that and so pretty much doable to do plab 1 during house job. So now coming to the mocks and big mocks on how to assess if you're ready for the exam. So we will be talking about that and then we will move forward to the questions. So we have almost 5 to 6 questions and we will make sure that we answer your queries. So regarding mocks and big mocks, Saad, how was your score in mocks? How many mocks did you did and what was your score in mocks?
uh, yeah, so Khubab, mocks are these are practice tests. They're not only there to judge your preparation, but most importantly they are very important for time management, for uh, getting yourself accustomed to the exam conditions. Um, and Yeah, as for your question, I remember I used to have a score of I did like 8 or 9 mocks, and I had a score around 77 to 85%. The lowest I guess
Uh-huh.
was 77, then the highest maybe 85%. Uh,
Mm-hmm.
so yeah, one
Hmm.
mock you should do before you start your preparation. Okay, and you will get a lot of questions wrong. But the thing is, you are doing that mock just to know where you are standing, um, what your baseline clinical knowledge is. Before you start, you should do one mock, and
That's a good idea.
afterwards,
That's
when
a
you
good
have
idea.
like 15-20 days left, uh, afterwards when you have
Yes.
15-20 days left, then you can do the rest of the mocks. Um, so I would suggest that 8 to 10 mocks are enough. The reason being that if you do more than 10 mocks, if you start doing 13, 14, or all of the mocks, it just becomes repetitive. Because the Plabible mocks, they are using the questions, they're just recycling the questions from the bank itself. So I think 8 or 10 mocks are enough. You should aim to do these mocks in exam conditions. Try to do them on an OMR sheet. Mark the questions. Fill the circles and the rectangles. Um, you should set a timer of 2 hours and 30 minutes, 2 hours and 40 minutes, and try to complete the mocks within that time. So, because in the real exam, time will go much faster, let me tell you. So
Hmm.
if you feel
This
the
is
need to
the
do more mocks,
OMR sheet.
yeah, that's an OMR sheet, the one that's used in the PLAB1 examinations. And if you feel the need to do more mocks, you can do something called big mocks. So big mocks actually are made up of questions that are not in the question bank. Uh, Usually they are a bit expensive. They are purchasable from the Plabible website. I think it's £30 or so. But if you go online on various WhatsApp groups, you can find the big mocks. People have, made into a PDF and shared online. So there are many free big mocks that you can get on the internet, and you should also attempt them under the same exam conditions and the same timings. And the big mocks will be a bit challenging for you, and the score you get in the big mocks, it is more reflective of the score that you will get in the real exam. um, yeah, so I
Hmm.
remember in
That's true.
my big mock I got like 140, and yeah, 140 or 135, and my exam score, it was similar to that. And I just want to add something that if you fail the big mock, if you don't perform that well in the big mock, that is not a measure of your capability to do well in the real exam. So just take it as a learning experience. Try to use the mocks to sharpen your time management skills. And yeah, okay. So you don't need to get discouraged if you don't perform well in a big mock. You can always, do more mocks. You can practice more. And yeah, that's it for the mocks, I guess. Anything you want to add, Kubab?
Yes, my mock score was when I started mock 1 month before the prep. They were ranging between 120 and 130, and after 2 weeks, I was getting more than 150. And I found big mocks to be very predictable. One tip which I can give to all of you, that do big mocks by printing them on a paper. And do it on OMR sheet. That is very useful. I did big mocks like exactly 3 days before my exam, three mocks in a row per day. And when I was in my exam on the real day, it felt like just doing one of the mocks. I had no anxiety of the uncertainty if I have a paper in front of me, because it's a huge booklet. When you will get a paper, it's really a huge booklet. One page has one MCQ or two MCQ, but sometimes one MCQ, and it will feel like it will never end. But honestly, if you practice your exam on a paper, you print it out, take a print out of big mocks, it is very beneficial. So that's the tip which I can give. And I used to do big mock at the same time of my exam. I gave lab one in Dubai, which was started on 2 p.m. and ended on 5 p.m. So I used to do mocks on that same time, which really helped. So, coming to the exam day tips, what are the exam day tips that you would like to talk about?
Yeah, so the most importantly, you should have a good night's sleep before the exam. Most people, like me, we study during the day and during the night, and we sleep at day. So if you have a routine like that, please start correcting it a week or so before the exam, because you need to have a good sleep before the exam. And not only that, you need to have a clear mind, you need to be fresh, uh, you need to be present, because if you're feeling lethargic, if you're feeling fatigued, it will unfortunately affect your exam. Okay, people might not accept this, but this is a big factor, in their performance. um, because the PLAB one, when you people will give this exam, you will realize it is a very mentally draining experience. The 3 hours, they really, drain all of your energy, because you're constantly focusing on questions, and you do not even have a single second free to relax your mind. So first and foremost, have a good night's sleep, reach the exam center early, make sure to take your documents. For the people who are giving the exam in a foreign country, take your passport. If you are giving it in your own country, I think the national ID is enough. And you can take your water bottle, you can take fruits and chocolates, but with the labels removed. As for the exam itself, please, I know it's very easy to say, but try to calm yourself, try to calm your nerves, so that you can, focus on the questions, focus on reading the questions. Um, this is very important. Do not waste your time by recording your answer on the question sheet. Just directly transfer the answer on the OMR sheet and fill the bubbles instead of leaving it for the end. Um, and when you are attempting the paper, do not spend more time on a question more than it deserves. Okay, I think there are 180 questions and you have 180 minutes, so approximately 1 minute for each question. So if by the end of 1 minute you haven't solved a question, it's very likely that you probably won't be able to. Okay, so it's better to save that time, save that extra thinking, extra seconds for some question that you have a better chance of solving. Okay, like there are some questions in epidemiology or ethics that might require a bit of extra time to think. Okay, they might require you to do some calculation, some scribbling. So if you're not able to get the answer, if you find that a question is really confusing, it's really new, just give, there's no negative mark. You just, mark whatever answer comes in your mind, do a tukka and move on. Okay, just don't waste time. Okay, this is for those of you who um, from Pakistan. We have the MCAT exam and we have negative marking in it. I think it's finished nowadays, but in our time we had negative marking in it. So that was a whole other uh, dilemma. You didn't know if you were attempting a question wrong, or you should just go for it. So there's no negative marking in the GMC. If you don't know an answer, just move on. Okay, don't waste time, and don't leave any questions for the end except for a few questions like from epidemiology or genetics, because those questions, they might require a bit of more time, they might require you to do some calculations or some scribblings, so you can leave those for the end, but otherwise try to do all the questions in one go. Okay. um,
Hmm.
do not experiment, do exactly as you used to do your mocks. Okay, and this is also very important. Whatever approach you are using for your mocks, just do it. Okay, do not try to change your approach, do not try to pull some stunt on the exam day. It will, it can mess up real bad and real quick. um, yeah, and this is an advice for people who have small bladders. um, just go to the toilet before the exam. Okay, because if you go, you are allowed to go to the toilet in the real exam, I think after 1 hour, but it will waste valuable time. So if you need to go to the toilet, go beforehand and don't drink a lot of water or tea. um, so yeah, time your bathroom breaks
Yes,
accordingly.
it's a beneficial advice because they conduct their exam. If of course you have given OET, so you might have an idea. They have air conditioning, so it can get a bit cold. So that is a very important tip. So try to make sure that you go to the washroom like 15 minutes before the exam, and you can take your valuables to the exam center as well. British consul staff have give you the boxes to keep your items. Of course they don't take the liability if it gets lost, but it's very rare to happen, so you can easily take your valuables to the exam center as well. And now that's almost the conclusion of our webinar. We will now move to the Q&A sessions. We have a couple of questions. I will try to discuss them now. And you can reach out to Dr. Saad on his LinkedIn and Instagram as well if you need advice regarding that, any other thing. So now, Saad, I will be sharing the questions we have. So Arisha has asked us, is BSc exam useful for the CV making or induction?
Sorry, Khubab, could you repeat that?
Yes, she's asking, is it beneficial to give BSc exam, and does it benefit the CV or future induction in residency?
Okay. Alicia, that is a good question, and we will have a session very soon about the PLAB2 and the CV making, the steps after the
Hmm.
PLAB2, the GMC registration, and etc. And we will delve into those topics uh, uh, very deep.
Hmm.
For now, I will have to get back to you on that, as I'm not quite sure about it. But as far as I know, it's not a requirement for any of the first jobs in the NHS when you are looking. It just makes a good impact on your CV. Okay. When you are looking for jobs, it's a good impact that you have done BSc during your MBBS. Here in the UK, they call these
Hmm.
courses, they call these degrees intercalated degrees, which are the degrees that you do during your MBBS degree. And as far as I know, it doesn't help much the in the
Hmm.
process of getting your first job. But when you are training, I think there are a few marks for the BSc degree. Uh, you
Hmm.
uh, we can research about this and get back to you.
Hmm.
You can research about it yourself. But I think
Hmm.
when you are applying for training here in the UK, there are a few marks for BSc and for
Hmm.
things like teaching, and yeah, so it does help in the
Hmm.
training process.
Yeah, it's a fun exam. I remember when I gave BSc exam. It was a day before my community prof. So it was fun to study, and it was a little adventure, a little misadventure, and I passed it successfully. And I think it's you get a degree, you get a degree from another institute, so you should go for it, and it's easily doable for 2 weeks
Definitely.
of preparation.
Those of you who are in their final years or fourth year of med school, even the house officers here, if you can manage, you should do this degree.
Hmm.
It's not that expensive, and the exam is very easy. So yeah, you should definitely go for a BSc degree if you can.
Okay, so Tayyab has asked about OET versus IELTS, which is better, and they have asked about the validity of OET when you apply for registration. So for that, it is very clear from GMC website that OET needs to be valid at the time of registration. But if you have passed PLAB 2 and if your OET has expired in the past 6 months, then you can also get an exclusion from that as well. So we both gave OET. Saad and me gave OET, but other people have given IELTS as well. IELTS is a little cheap, uh, so it's your own decision which one you can afford. But both are easily doable.
Yeah, I think the OET is a bit easier. IELTS is a bit tough. But on the other hand, OET is expensive, and IELTS is a bit cheaper. So that is
Hmm.
up to you. And I
Taha
think
Khan has. Mhm.
even if, like Hubab mentioned, even if your OET has expired, but you clear your PLAB1, or you get your GMC registration within, I think, 3 months of it expiring, they still consider it valid. And
Hmm.
even if it has expired like 5 or 6 months ago, I think you have to show them some competency that you still can speak English, and they might make exceptions for you. Okay, as long as it's not too long ago. So GMC can make exceptions if your OET has recently expired, like a few months before your GMC registration.
Hmm. Yes, it's clearly if your OET is expired for more than 2 years, it's clearly mentioned that if you have taken PLAB 2 recently, then it's again valid as well. So now coming to another question by Taha Khan, he's asking, is it as advisable to prepare MRCP1 while one is waiting for the test date to arrive, giving 3.5 months to PLAB1 and 3.5 to 4 months to MRCP1?
So I have to be honest. I don't know much about the MRCP because I have not uh, prepared for it, and I don't know any of my friends or colleagues who have. But as far as I know, MRCP is a tougher exam, and it's a lot difficult to pass than the PLAB1. Um, and People do say that if you have an MRCP1 passed, it might help you a bit in the jobs. It's not a requirement. In some jobs, it might be a desirable criteria. It's a good CV point, but that is entirely up to you. If you think you have the time, if you have the resources, because the MRCP1 is an expensive exam. It's like 600 something pounds if you give it in your home country, um, and it's a difficult exam. So that is up to you. If you feel you have time, if you feel you have the preparation, go for it. Okay. When In the PLAB journey, you should always aim high. You should always, uh, strive to make your CV as better as possible. So yeah.
Hmm. And Bilal Hussain has asked that he has approximately 10 months left, and he has revised and read Plab keys and Plabable. And
Mhm.
he's asking, would you recommend focusing on mid revision for the next 3 months to solidify understanding of concept, and followed by returning to Plabable? Or alternatively, should I continue studying Plab keys and Plabable throughout the entire 10 months?
Um,
Hmm.
Sorry, what was his name?
Bilal.
Okay. So, Bilal, I would suggest that you focus on one resource, because like we mentioned in our webinar, there's nothing magical in any of the particular resources, like med revision, Plabable. They're all the same. Okay, the questions are of the same style. uh, the explanations they give, they are from the same resources. So if you want to do something extra, you have time, you should focus on reading up about those topics on the patient.info, or learning the NHS guideline, the NICE guidelines. um, I think you don't need to go to med revision and then come back to Plabable. That's just unnecessary hassle. um, if you do want, if you do feel like it, you can do you can borrow med revision from someone and do it for a few days and see how it feels like.
Hmm.
But I would suggest sticking to one resource, and it is entirely enough to pass the exam. Plabable is enough.
Hmm. And we have a question. They are asking how to use the gems, and should you read them alphabetically?
How to use the gems and
Yes. Should read them alphabetically? I think
okay.
for that you
Yeah,
can start by any topic,
you can
especially
start
the
by any
big
topic. Yeah,
chunks.
it's up to you.
Yeah.
You
Yes,
know,
but if
yeah, okay, yeah, I understand his question now. Yeah, you can use any sequence you want. Okay, we would recommend that you start with topics that you are good at, that you find easy, and go on to more difficult topics towards the end. So that is up to you. But we would recommend starting from topics that are easier and then go towards topics that you find more difficult.
hmm. Okay, we have a question. Kalimullah is asking, what is the passing criteria? Kalimullah, the passing criteria is roughly the score of 110 to 115. It keeps getting varied according to the exam difficulty and the performance of the candidate, but it remains between 110 to 120 out of 180. So 180 questions and 180 marks. Every question has 1 mark. Another question from Moise. They're asking how much total money is needed for complete lab journey, and we will cover that question as well in the end. First, Let me take the
Yeah.
question
So yeah.
related to Plab 1.
Sorry, Web, I'm interrupting. Guys, you have some wonderful questions, and we really appreciate and welcome all your questions and queries. But we will have some sessions on planned on PLAB 2 and the whole journey, and finding a job and etc. So could we please focus the question for now on PLAB 1 and related to PLAB 1, and whatever questions are left, we will try to get back to you personally on your WhatsApp, or we will make sure that we reply to you.
Hmm.
Um,
Yes.
so yeah, could we
Yeah,
keep
the
it
question related to CV and question related to the getting a job, we will surely arrange those webinars soon. Fatma Tariq has asked how much does Plab pathway cost? For now, Plab 1 cost is £255, and the gems, if you get any subscription of Plabable, it costs around £30.
Okay, so a few people have asked this question about the PLAB journey cost. So I think we should answer them, even though we will have separate sessions for it. But because a lot of people are asking this, I'd like to answer. Um, so PLAB 1 costs £255. Then you have you have the question banks. Um, they cost around 35 to £50. Afterwards, when you are done with your PLAB 1, the next step is getting your degree, Epic verified. That costs around $200, right? Kumail?
Yes, Epic verification is roughly about
$230.
$200.
Yeah, that costs around $230. Then you have the PLAB 2 exam. It costs around £934. Um, Afterwards, you have the visa process, I guess. Uh, and from Pakistan, we have to, the visa fee is like £100. From your countries, it might be a bit different, but roughly it's around 90 to £100, £150. Um, then you have to show a bank statement. That is very variable. People may show, £3,000, £4,000, maybe more, maybe less, depending upon their particular situation. And for those of you who join an academy, most PLAB 2 academies, they are 500 to £600. And if you are living in the UK, that might cost you, if you are having your own accommodation, if you're arranging your own accommodation, that might cost you around £800 to £900 a month. um, and then you have £170 for GMC registration. So that's the rough. That's roughly how much the whole PLAB pathway costs. It may fluctuate a bit depending upon your conditions, upon your particular journey. So yeah. Any more questions, Khubab, related to PLAB 1?
Yes, we have a question. Hamza Tahir has asked Dr. Saad, if someone has time for exam, should he go for Medrovian first and later 3 months before exam do Plabable? Is this a good approach? Um, I can answer that question for you, Saad.
Sure.
As he has already explained, in my opinion, I would recommend that you go for both, but of course it's your own choice, it's your subjective opinion. But if you have finished Plabable and you still have 3 months and you want to mentally stimulate yourself, you want to challenge yourself and test yourself, then it's a good idea. If you can afford, just buy the Medrovian and then do the question if that makes you feel secure about your preparation. So of course you should do Plabable if you can finish it, but then you can go for Medrovian, and you, of course you will score well. Like you can score 160 plus or 170, and you can get really good grasp. So the more questions you do, the more practice of your knowledge will happen.
Exactly. There is no you know upper limit to what how much studying you can do. Um, uh, you can always study extra information if you feel like it. There's no stopping anyone. We encourage that you prepare well for your PLAB 1, because this knowledge you will carry uh, into your future career. Um, but for those people who just want to know the minimum requirements for passing the exam, uh, f- for those people, we just want to make it clear that if you stick to one resource, that's enough. But of course, if you want to study more, you can always use other resources. You can, switch it up. You can do some med revision, or you can do some Plabable, whatever works best for you. Okay, it's all about your own comfort zone.
And another question from Abhinaba Saha. They're asking plab gems are not subject wise like endocrinology or pediatrics. They are alphabetically given. So, how to approach them in the best way?
Yeah, it doesn't matter if you approach them alphabetically or not. You know, um, if you're doing your internship and you are, for example, doing your medicine and medicine allied rotations, you can start by doing medicine topics first. If you are doing a surgery or surgery allied rotation, you can start by doing surgery topics. And if you're doing peds, you can start with peds, whatever works best for you. Okay. um, and if you're a medical student, you can just do the topics that you feel are easy for you. Like I mentioned, I did cardiology, I did medicine. So whatever works best for you, it doesn't matter whatever sequence you choose. What
Hmm.
matters is that the topics that are difficult, that you have never done, you should opt to do them at the last, so there is minimum time left between the last revision you did and your exam, and the knowledge is fresh in your mind. Okay. If you, for example, do those difficult topics months before, obviously you will have forgotten them by the time you get to the exam. So yeah.
Another question
So
by Daniela Densley. She's asking that I still don't see how logistically you can plab your study schedule. You can plan your study schedule for plab one while working full time. I managed to do some questions 1 hour before work, but when I finish, I'm so tired that I just want to go to bed. At the end, I only have weekends to revise, but I lose continuity during the week. And she graduated 13 years ago and worked in cosmetic medicine, no hospital job.
Yeah,
Um,
that is actually a very valid concern, and I can understand how difficult it must be for you, because most of the people, the candidates we have, are recent graduates, and I have heard this concern from people who have been out of touch with their academics, or uh, study the academic side of the medicine for a long time. What you can do, Daniela, is that in a few weeks, in a short time, we might have some crash courses available for different subjects. You can opt to do those crash courses. In the meanwhile, what you can do is uh, go through all the PLAB topics. Like if you open cardiology, go through all the topics that the cardiology gems have, note them down in a notebook. And whatever textbook that you found easy during your med school years, or you can use online resources like the NHS guidelines, the NICE guidelines, or patient.info, and start reading up on those topics. Okay, refresh your knowledge. Because you have been out of touch for a long while, I would suggest that you take a bit of time to reorient yourself, to study a bit, and then start the question bank. Don't just throw yourself in the question bank, because it will get very confusing for you. So take spend a few months, uh, revising all the topics, going through medicine, surgery, peds, gynae at least, and then you can start using the question banks and prepare for your exam whenever you choose to book it. But I completely understand. What you can do is, for now, just use your notes and just catch up on your knowledge.
I have shared a video, Daniela, which you can watch. We also give coaching, personal coaching, and tuition, especially those who have graduated a long time ago. So you can connect with us on our Instagram and you can watch the video. We will try to make a study plan for you and help you revise all the previous concepts. Another question by Aisha Server. She's asking, during house job, how many hours per day should we study at least, and what should be our study schedule?
So yeah, Aisha, that's a very good question. Thank you for asking that. Um, I don't think there's a fixed criteria of how many hours you should study. It depends on how much time you have left and how much free time you have during your rotations. Like if you're doing a 1 in 3 call, or if you're doing an alternate call, obviously you won't have much time, and uh, the study that you normally would have done in 1 month, it will take you 3 months during house job. So plan accordingly, okay? um, if like for example, I can tell you from my personal experience, because I was going through a house job. um, I had to start my preparation 5 months ago. But if you are free, if you don't have a hectic rotation, you can even do it in 2 months, 3 months. So it all depends upon you. The important thing is to be consistent, and just keep studying every day. Read your notes, even if you're not doing a question bank. Just go through your notes, just read them like the newspaper, just read them like you're reading a blog, and be consistent, okay? As long as you're
Hmm.
consistent, as long as you're constantly learning, um, it's all right, okay?
Hmm.
Also,
Aisha Servers has
I asked how
also.
important is research for PLAB journey.
Hmm.
um, the thing is, Aisha, nowadays the NHS system is getting a bit saturated. So even though it's not mandatory to have a research, and it is advisable to improve your CV. So if you can do researches, good. That's wonderful. You should go for researches because it will help you a lot. A lot of the jobs here in the GMC, they ask for research experience. They ask for audits, QIPs. So yeah, you should Google audits and QIPs, and if you can do them, you should go for audits, quality improvement projects, and obviously research is good. Is it is good, yeah. It's very important. It's not a requirement, but it will definitely improve your CV. So yeah.
Hmm. Thank you, Saad, for answering all the questions in so much detail. The last question we have from Aisha Basi. She's asking, how long should we do big modules in, and which modules are the important modules? Aisha, we have shared this slide. Please take a screenshot of this slide, in which we have tried to divide the topics, the big topics which you have to do first, and the small topics which are really important in high yield, and they can be tested more, and the topics which you should do at the end, and the topics which are less important and which you can keep for the last days. So take a screenshot of this. Also, she have asked, how many times should we revise PLAB keys?
Um. So, Aisha, I did Plab Gems, and I think I did Plab Gems once for each topic, and then I revised the Plab Gems almost. I think I revised like 70% of the gems once. So I think one revision is enough, you know, or you can even do two revisions if you have time. But I did just one revision, and I was easily able to pass the exam. But you do need to revise. Yeah, you do need to revise once, because when you're attempting the question bank for the first time, it takes you a lot of time. It may take 2 3 months, even more if you're doing your internship or a job. So in the end, you need to revise, and you know strengthen all that knowledge that you've gathered over the past few months. So yeah, one revision is must.
Hmm. And those who are asking about the PDF, I'm sharing the PDF. I'm sharing the PowerPoint link, and we will also share it in our WhatsApp community as well, uh, where you can access. If you want to join the WhatsApp community, all you need to open your browser and type this link, bit.ly/Plabish WhatsApp, and that's how you can easily land into our WhatsApp community. But I also have shared the link to access this document, And we will also keep on changing and improving it if we have more data about PLAB1 journey. And regarding the question about Abdullah bin Kamran, you have asked about finding a place to live and what are the common problems and documents. We will plan a webinar soon, so stay connected on Instagram for that, in which we will be taking NHS doctors who are currently doing their training or are consultants, and they will give a detailed guidance about that topics. Thank you all of you for joining our webinar. It was our first webinar, and we hope that we didn't disappoint you, and you found it useful. And if you have
Yeah,
any feedback, yes,
yeah,
if you
guys,
have any
thank you
feedback,
so much
you
for
can give it
joining
to
us.
us.
Yes, sorry, Khubeb.
Yes, and if you want to support us, you can support us is to spread the words, and especially the fourth year and final medical students stay connected with our page, with our Instagram page, and this is a way to stay connected with the PLAB1 updates.
Yeah, so once again, thank you so much, everyone, for joining us. And I just want to say that when you are when you are starting this pathway, it looks very daunting. It looks tough, but uh, a few months, a few years down the line, when you will have done your PLAB 2, when you will have gotten registered with the GMC, this will all be worth it. And I think all of you are perfectly capable to give this exam. And so yeah, you guys are all perfectly capable to give this exam. So best of luck to all of you on your journeys, whatever they may be. And whenever you require any help, you need any guidance, we will try our best to be there for you, me and Khubab. And hope you all have
Also,
a great day.
Hamza has asked about sharing my journey in UAE experience and giving PLAB there. Sure, I will have a webinar soon regarding that, how I went to Dubai and how was my experience giving the exam in a foreign country. And we will try to ask to cater to your queries there as well. Thank you for your feedback, for your positive feedback, and it means a lot. So now I will be concluding this webinar, and I will post this video on our YouTube as well, which you can access and share with your friends. Thank you so much for joining in.
Okay, thank you
Thank you,
everyone, and
Saad,
thank you Khubab.
for your time, for taking out time from your weekend.
No, no, you're welcome. You're welcome. So
Okay. Bye bye,
okay,
everyone.
have a nice
Goodbye,
day.
everyone. Goodbye.